Cardiac involvement is a defining feature of Hantavirus cardiopulmonary syndrome and a significant complication in hemorrhagic fever with renal syndrome. While historical views categorize the cardiac dysfunction as purely functional, modern evidence confirms a combination of direct viral effects and a profound cytokine-mediated inflammatory response that leads to myocardial depression and shock. The hallmark of cardiac involvement in hantavirus infections is increased microvascular permeability and myocardial depression without significant direct cytopathic damage to myocytes. Typical myocarditis. Foundational studies identified hantaviral antigens and particles specifically within cardiac endothelium and interstitial macrophages, accompanied by interstitial edema and myofiber necrosis. The cytokine storm. Myocardial depression is largely attributed to high levels of soluble mediators including TNF-alpha, interferon gamma, and nitric oxide. These cytokines impair endothelial function and directly inhibit myocardial contractility. Functional versus structural. The shock state is an atypical septic shock where low cardiac index and low stroke volume index are accompanied by high systemic vascular resistance, mimicking cardiogenic shock. Patients often present with sinus tachycardia in some variants or bradycardia in other variants. Severe cases can mimic ST elevation myocardial infarction due to diffuse ST segment changes and wall motion abnormalities on echocardiography. Typical findings on echocardiography include depressed left ventricular ejection fraction and pericardial effusion. Remarkably, myocardial function may recover fully in survivors within 2 to 4 weeks. Survivors of severe hantavirus infection may face persistent cardiovascular and systemic burden. Up to 80% of survivors report long-term fatigue and over 50% experience dyspnea 3 to 6 months post-discharge, regardless of whether they required ECMO. Long-term follow-up of certain variant survivors has indicated an increased risk for acute myocardial infarction, hypertension, and venous thromboembolism.